Hey guys, my name is Sarah Catherine. I'm with Steinecker and Dillon. Today I am joined by Dr. Nizam and
Hello.
Lily Nizam.
Hey.
They are with Alabama Surgical Arts, and if you saw our Facebook post a couple weeks ago, we asked if you guys had any burning questions about Botox or filler, and you guys left us some really great questions, so today we're kind of debunking those myths. Are you ready?
Ready to go?
I'm excited. Let's go.
Okay, awesome. So the first question is, what areas of the face are safe for filler, and how long does it typically last?
I will tackle that one first. Pretty much any area is safe on the face to add filler. Obviously, it needs to be an area where you need filler, and that's kind of where we come in with our consultation. There are some risks to injecting in certain areas, and that's where knowledgeable of facial anatomy, blood vessels in the face, things like that, you need to avoid when you're injecting, and using different techniques to keep it safe. So to summarize, yes, you can pretty much add volume through fillers anywhere in the face where it's needed in an aesthetic manner. Keeping it safe is really the most important thing in all of that. Lily, do you have anything to add to that?
Yeah, I think definitely avoiding any vascular occlusions, things like that, would definitely be our primary concern. And making sure that the facial ratio where you're putting filler would match up with, the concepts of beauty would be most important as well.
And then I think a follow-up to the question that was on there that you just said was, how long does it last? And that's kind of a tough one. They really last, hyaluronic acid fillers, from anywhere from 6 to 18 months. And it's dependent on product. It's dependent on where they're injected, actually. Some areas of the face that are more dynamic, like the lips, will require injections more often. And then other areas around the eyes, even the nose per se, if you wanted to add or sculpt the nose with filler, those areas actually last a lot longer. And some of the just different products, so Volum is a product we use to highlight the cheeks. That product lasts anywhere in their studies up to 18 months. They did have some touch-ups when they did them. So you can see there's a vast length of time of difference that they can last. And there are actually some permanent filler solutions and semi-permanent filler solutions, but I think we always say, especially if you're new into this, it's good to start with a hyaluronic acid filler because A, it's reversible very easily. There's something called hyaluronidase that you can actually dissolve it completely with, and it will be gone within a few days. So we always recommend starting with that just in case you're unhappy with it or you just want it changed.
So I have heard some, is it true that if you exercise more or drink more or do things like that, does that
I mean, I don't know if there's, and I always base all my decisions off what the literature says. I don't know if there's ever been a study to really say that. I haven't personally seen that happen. I think it's really, again, what product you're using and the region of the face, because the region of the face, like I said, lips, that is a lot quicker. That's more on the 6-month spectrum. Around the eyes and other areas, those can be up to 18 months. So those are the big things.
That's a long time difference.
I know it is. It's a huge difference.
Okay, next question. Is Botox effective for TMJ?
Yeah, it is. So first thing I will say is, and this is kind of a sticking point for me, TMJ is kind of a misnomer. TMJ is the temporomandibular joint. So that's actually the term for, our head almost fell off. That's actually the term for the joint itself, so temporomandibular joint. TMD is kind of the inclusive for temporomandibular dysfunction.
Okay.
So a lot of times you'll hear us say that, so just so there's no confusion on that, but it is a very effective tool, but you have to make sure you're treating the right thing. Okay. So there can be a lot of different problems in the joint itself. It's obviously not really going to treat what's called an intra-articular disorder, which is one that's inside of the joint. That's a problem with the disc. But a lot of people, this all-encompassing term TMD, have actually a muscular component of the pain, and that it is very effective for. So we typically will inject into the masseter and the temporalis. These are the two really strong muscles that you will use to clench down, kind of the end of your bite where you really get a lot of that strength. And a lot of people can get a lot of relief with that if their pain is muscular in origin. If there's somebody who's maybe does a lot of grinding at night, maybe they've had success with a night splint or something like that. To summarize, it's very effective, but you just have to make sure you're treating the correct etiology.
Right.
Anything to add to that?
Bonus, you slim your face with the mask.
You do. So actually sometimes injecting that same muscle, and Lily has done it because she likes her face at the bottom a little more narrow. Yay! It is very effective for that too. So it's something we tell our patients too when we do it. Your face is going to get a little more narrow because that muscle, if it's not being used, just like if you had a cast on your arm for 6 months, you get atrophy of that muscle, so it shrinks down a little bit. Now, as soon as it wears off, it goes back to normal. So it's not a permanent thing. And I think there was another question somewhere, if I remember, I saw on the website about well, how long does it last, or how long do you need to redo it? And I normally say about every 4 months for the TMD, and it's just when it starts bothering you again.
Okay. That's great. So like kind of killing two birds with one stone.
I know. It's nice.
Pleasure and pain-free.
I find myself clenching my teeth less with
Oh.
Botox. So
Yeah.
Because I clench my teeth like all day long, so it helps.
And that's something we warn our patients about too, especially right when you get it done for the first time. We've had a lot of patients go, man, I went to go bite into a steak and it was kind of hard to really mash down. So I always warn them, you're not going to be able to have the same strength and biting force, which is good because then you're not overloading the joint, you're not stressing those muscles, and that's kind of how it's working, but you just need to be aware of that.
Right. That's something to think about. That's awesome.
I know.
Okay, so the next question is, how long does Botox typically last? So outside of
exactly. And it's about the same. It's about the same no matter where you're going to use it. So it's about 3 to 4 months. I don't say 4 months. And the question may come up, well, how often do I need to do it? Everyone's a little different. Like males who have heavier muscles, especially when you're using for cosmetic uses, they typically need a little bit more than maybe a female, especially first-time users or people who haven't been using it for a long time. They will need longer intervals, they'll have to come back less, basically.
Okay.
But everyone's different. And it's dependent somewhat on the amount and the dosage you use, too. So, like the fillers question, there is a little bit of an array, but, 4 months is a good solid estimate. Anything to add to that?
I think definitely for people who don't understand our recommendations in the beginning, they want to do lesser dosage. They have to understand that the lesser units will then translate to more frequency.
Yeah, exactly. So that is something there is a dose dependent frequency that goes on. And I think another thing too, just to tackle, not necessarily in the question, but Botox is a brand name. It's just like Advil is ibuprofen. So there are other brands. There's Dysport, which is one we have here, and there is Xeomin. We don't have that one here, but they're all good options that you can use. And I think just people need to understand that when they come in, that Botox, again, it's just a brand name.
Right, it's like saying Google. Like
exactly,
you're like
same
Googling
thing.
something, you're just like searching.
Yep. So there are other options and different prices on them, and that's something we can always talk about when we come in. And I honestly would say half of our practice is probably split between the two.
Yeah,
so,
really?
I agree. Yeah.
I mean, secretly, not so secretly, I've had both, and I love both.
they both work, and they're, they have little minute differences, but honestly, they're pretty much about the same.
Right. Okay, so the next question is, at what age should someone start getting filler?
Oh, okay, that's a loaded question.
I know.
Yeah.
Okay.
So, fillers, I would say, probably the earliest I've started on someone was probably in their 20s, and that would be more for like a congenital issue. And I mean, that sounds very surgical, but maybe your lips were small, that you were born with smaller lips or something of that nature. That would be the person in the 20s. As you start aging and you start getting into maybe your 30s, that would be something you can move into, maybe like lower eyelids or something. A lot of people will start getting bags under their lower eyes. That's something you can address with that. So, I always say maybe mid to late 20s for maybe something like lips, and then maybe you're starting when you're getting in your 30s. Some of us who are younger and athletic, some of us who age more. I have fillers under my eyes. I have fillers in my cheek. Because I actually started aging at a younger age, so that's how it happens. Because I'm thinner and I can benefit from volume. So somewhere around the 20s to 30s.
Yeah, I agree. For people who are younger, they most likely are just augmenting their look, so they're not replacing any volume. So like whether they want a better jawline or a nicer chin or a nicer nose, things like that. They're just basically just changing the way they look would be what they're doing in the 20s usually.
Yep.
Awesome. Okay, so next is it possible to schedule twice a year for when you'll be around more people? And does your face just go back to normal by the time it wears off? I know we
did,
answered that.
But I think we can touch on that a little bit more. So I would actually probably say don't schedule right around when you have you're expecting a big social event. We tell everyone that because it's kind of luck of the draw. We do a lot of techniques here to avoid bruising, things like using cannulas and things of that nature. However, unfortunately, you bruise sometimes. And that's really the only, negative when you get fillers are that you can get a bruise, you can get a little swelling. So we always say you want to schedule it 1 to 2 weeks at least before you have a social event to go for. God forbid you need a little extra or a little touch up or something like that. It's always good to plan that in so you're looking your best and there's no swelling, there's no bruising. Because bruises sometimes can last up to 10 days. And now they can be covered with makeup right away.
Right.
But nobody wants to be walking around, at a big social event.
Have to touch up on that.
Covering makeup all over themselves. Yeah. So, in answer to that, yes, you can schedule it twice a year. And I think really the better thinking is come in, you get a consult, we correct the areas that you want to correct to their full correction, and then maybe at that point you only need a touch up every once a year. Maybe it's twice a year. But that's the better way to think about it. Come in, explain to us the areas that you want to address. We'll let you know if hey, are you a good filler candidate to start with, or maybe you're more of a surgical candidate, and we can present both options, and then say, well, let's correct it to the full correction at the first couple appointments, and then you'll just need a touch up from that point on, maybe every 6 to 12 months.
Awesome.
Anything to add?
No, you hit the road.
I'm just heading them out of the ballpark. Huh? All right.
So similar to the TMJ or TMD, does Botox really help with migraines?
It does. It is actually an FDA-approved indication. There are a lot of regions we inject. So the frontalis, basically this region behind the head, the occipitalis, the paraspinal muscles, and the trapezius. Those are the areas that we inject for that. Yeah, that's a lot. Yeah,
I know that. I wouldn't have thought.
And the temporalis. So it has been, if you look at the studies, it was improved, I think it was like 2011 or something. I don't remember the exact year.
It's not new.
No, it's not. No, it's been FDA approved a while for that use. And it has been clinically shown to decrease your headache days per month. And some of the studies, if you look at them, actually say that it is almost equal to people who are on like prophylactic therapy with any of the agents that are used for that. So it is definitely helpful. Is it going to completely stop all your migraines? No, but it definitely will help them and reduce your count of headache days per month.
Maybe I should get that.
I was just thinking, I was like, headaches. Okay, so another loaded question. How do you know which areas are best to get Botox?
Yeah, okay, so I think, that starts with a good consultation, all right? And you come in, you tell us what areas bother you. A lot of people sometimes will come in and just say, well, you tell me. But we like to hear from you what bothers you, because there's no sense in addressing things that aren't bothering you. And we're always there to give a little bit of helpful hand. Well, you may benefit from this, or kind of set up an area or a plan that would be most beneficial. Do you have anything to add to that?
Typically, I do try to figure out what the patient's coming in for initially, but then we do end up giving an all-inclusive consultation, including everything that we think that would make the patient, look better or feel better about themselves. So there's literally a gazillion areas you can inject Botox into. So
yeah, there are, and there's a lot of areas that I think people aren't even aware of sometimes. I mean, there are some areas in the lower face. The depressor anguli, which is this muscle right here, that kind of, some people just have that resting kind of frowning face. There's some terms for it I won't say right now, but you know what I'm talking about. Some of the platysmal banding here, when people have that, there's a lot of off-label areas that it can be used for.
Sweating.
Yep, sweating.
That's another question.
Yes.
Oh,
it is.
You're jumping the question.
You're jumping. So excited.
Did you pre-read the question?
Yeah.
I glanced over it, but I didn't
cheater. But yeah, there's a lot of off-label areas too. So it's just really getting their areas concerned, and then areas where we think you benefit from it. And honestly, it slows the aging process down.
Yeah.
The next question.
Sure.
Can you get Botox when you're pregnant?
No, you cannot. Now, I'll tell you, there are no real trials where people have actually done Botox on people who are pregnant. And to be quite honest with you, I'm sure in the United States, it happens thousands of times a year, because there's a lot of people who don't know they're pregnant who probably go get it, or don't tell their physician.
Right.
But that being said, it is not FDA cleared for that, and we don't do it just because there's a theoretical risk, although so minutely low. Most likely nothing would happen, but it's not worth any having, a deformity or something of your child.
Right.
Yep.
So no.
No go.
No?
No.
Negative.
No.
Okay. At what age should I start getting Botox, or is it more like when I kind of get wrinkles?
Okay, so that's a good one too. Man, there's a lot of like loaded questions.
I know.
They're not simple
We're
yeses
really
or no.
trying to be
I know,
tricky.
you're getting it. Okay. So I'll give my 2-second spiel on this, which I give sometimes. I've done Botox on people, honestly, in their 20s who are starting to get lines with movement. So there's two kinds of riddids, which is the medical term for wrinkles. There are static and dynamic. Static is at rest. Dynamic is when you're moving. You get the dynamic wrinkles first. So like a lot of us will raise our forehead a lot when we're young.
Which a lot of us can do.
Yeah, exactly. Well, I think we all can do it a little bit. But anyways, so as you're forming those creases over time, if you look at someone as they age, those lines will actually become, permanent in the skin, and those would be your static wrinkles. So if you start just when you start to soften those movements at a younger age, those deep creases will not form. You combine that with some good skincare, and you really can avoid getting them all together, to be honest with you. Starting younger truly is better with some of these. And now that we have multiple brands, sometimes we'll even suggest switching them up, like after a couple years, just to get more effect. To summarize the question, you can start as soon as you start seeing wrinkles that are bothersome, and you can even do it in a preventative manner.
Okay.
And I think the younger generation now is definitely getting towards more prophylactic Botox than wait until they get deep set wrinkles. Because the older generation, that's what they're coming in here for, and they're like surprised that people in their 20s or 30s are now getting Botox.
Right.
But that's the trend now. It's much easier to prevent the
A
wrinkles.
small wrinkle.
Right. Than to treat like really deep set wrinkles.
Absolutely, and it really makes a monster difference. It's one of those things where you do it, you don't really realize what it was like before. And then a lot of times too, if you wait till you get older, a lot of these people really aren't candidates to be able to freeze those lines because their brow may drop, and they're really more of a brow lift candidate. So, it's better to start a little bit younger once you start seeing those aging changes.
Yes, for sure.
Awesome. Here's your question. I heard Botox can help with an overactive sweat gland. Is this true?
That is true.
Yep.
So you can inject Botox into the palms of your hands for hyperhidrosis. Same thing for your armpits. You can do that to help with excessive sweating. Also, people are now in the more ritzy areas that can afford to do Botox. They can do it in the scalp to extend their blowouts, so you're sweating less, and you can go to the gym and do your thing, and it would not mess up your hair.
Okay, I'm gonna be totally honest with you.
So
I didn't even know people were doing that.
I didn't know, but I'm
That's
like,
crazy.
whoa.
That's why we have Lily here.
Yes.
Ritzy Lily. Okay,
Yes.
funny. No, but
nickname.
but it does work. The same neurotransmitter that we're blocking that signals the muscle to fire, works and signals the sweat glands to produce sweat. So it works the same way. You may notice if you get it on your forehead that your forehead is less sweaty.
My mind is just blown right
I know.
now. I feel like I just need to sit on this
I
for a
know.
second. Think about washing my hair less. Okay, the next question is it possible to get a combination of Botox and filler at the same appointment?
Yeah, and we recommend doing it a lot because they are synergistic in some areas for sure. A lot of times around the eyes we'll do it, and it depends on the problem you have. But that being said, we do them together. They help together. If you think about it, if you think of a deflated balloon as it gets wrinkles in it, well, filling that balloon back up, adding volume back, gets rid of some of those wrinkles, and then relaxing the muscles that are making those wrinkles as well helps. So if you think about that analogy, you can see how the two together are very synergistic, and you can get a great result.
And you don't have to come twice.
Exactly. And if you have bruising, it's only once. That's another good way to think about it.
I like that. Okay, final question. Sad it's coming to an end. How often would you, well, I guess we kind of answered it, need Botox for TMJ every 4 months?
Yeah, about every 4 months. That's
Or
a good
when you
one.
feel
Or
pain.
when you start having pain, yep.
That's it, guys.
Cool.
Thank you so much for asking these really awesome, loaded questions.
They're great.
Putting them to the
Yeah.
test.
Yeah, we're good.
If you guys have any questions, you can always contact them directly. Any parting thoughts?
Yeah, check out our website. It's www.alabamasurgicalarts.com. Instagram account, Alabama Surgical Arts, as well as Facebook. We got a lot of good information on there. The website has a lot of great information too if you just want to read up. It's always good to come prepared with questions. We really like answering them, and we really favor having educated patients. We prefer having the people who come in and who have read up a little bit and have good questions to answer, because I think everything works better if you have some base knowledge of this stuff. But we're always here too to educate. We're willing to give our time to make sure that everybody knows what they're getting into, what we're trying to accomplish. I think that's our big thing.
Well, awesome. I'm so excited to have you guys in the neighborhood and in the Montgomery area.
Yeah, I'm excited. It's been amazing. So I'm super glad to be here, and hopefully we'll meet all of you guys who have questions about Botox and filler, and hopefully we can treat, a ton more people.
Awesome.
Awesome.
Thank
Thanks,
you.
guys.